in Blackboard first today. So remember, this link has always been here. This is a link that you can quickly go to your Connect assignments instead of having to look through the folders when I assign them. And you should be doing them as I assign them. If you click Go to My Connect section, it will actually take you to the Connect homepage. Depending on your browser, you might have to OK a in-between screen like this. So for you guys, it looks a little bit different. And I don't think, oh, I can go to a student view. There we go. Okay, so your status right here should say see report if you've completed the assignment, right? If you haven't completed it yet, then you need to do so. So you'll see we're nearing the end of the semester. There are 4 assignments down here at the bottom that I just made a folder for today in Blackboard. These are topics that I'm going to they're interwoven in the next couple of chapters, but it's definitely stuff I don't want you guys memorizing for tests. Try and minimize that. But it's required material that you guys have some type of assessment on it. So what I have done is done the Connect assignments instead of a test. Okay, so they're available now, and you need to get them done by test 4. Although they won't be on the test. And then we have, as you see, the next couple, we'll finish up wound today, we'll hopefully start skin, and then respiratory is going to be our test 3, and then digestive, nervous, and blood and lymphatic is going to be our test 4, right? And again, we're going to follow those objectives. So I'm going to return to Blackboard. So also to make it a little bit easier for you guys, and I'll do this soon too for the next unit, I made a folder just with the objectives in it, okay? And this is related to a bonus assignment that I promised I was going to tell you guys about. If you write out or type out your objectives, right, write out the answers, basically your notes, right, what you should have been doing anyways, and you show them to me or email them to me by class time on Friday, I will give you 50 bonus points for completing that assignment. Okay? For Friday.
Is that the objective this Friday?
This Friday.
Objective
for these three topics that we've been doing, right? And that we'll continue to do. Okay? So you may be working ahead, and to a certain extent, you may be already had written out some of them, right? So definitely make sure that you're doing that. So I'm going to encourage you to do so by awarding bonus points. Okay, and I'll do a little write-up on that to you can, if you type it, you're fine to email it to me, so that way you don't have to necessarily print it out, right? If you don't have access to a printer, if you're one of those ones that types up your notes, if you handwrite them, then you can just show them to me in class. Yeah.
And the answer, right?
Yeah. Yes. Very important. You're writing out the objective. More importantly, the answer to the objective, right? The answer, right? Not just writing the objectives, but the answers to the objectives. Basically, your notes. Okay. So one other thing that I wanted to point out is that we started a new unit, so we have a new discussion board, right? So under discussion boards, and I had it in last time's folder, but I forgot to mention it to you guys, and I just want to make sure that I'm clear, crystal clear. So the next one is infectious diseases, and so you get to pick any infectious disease covered in our book. It could be one we cover for class, it could be one we don't cover and then you're interested in reading about, okay? For each of these, make sure again you repeat the question. So, number 1 is to name the causative agent, right? What actually causes the infectious disease? The name of the virus, the name of the bacteria, the protozoa, the fungi, whatever it is that you picked. List signs and symptoms, right? So you'll write that and then list them. Describe pathogenicity. How does it make us sick, right? We've been kind of talking about this as we've looked at some of these diseases, right? Some of them produce toxins that destroy our body. That's one of the main common attributes to a lot of bacteria that are pathogenic, right? We haven't really gotten to many viruses, but we will. How's it transmitted? Where does it come from, right? So Do you inhale it, right? Do you eat it? Is it in the environment? Is it, how do you come in contact with it? And then describe treatment and prevention. And make sure if there's no treatment that you say so, right? Say that there's no treatment, right? If you use your book, you can just list the page numbers. If you use an outside source, you must cite it using MLA format, okay? And include the website if you're using a website. And then, as always, right, all our discussion boards are going to have, you need to reply to 2 other people, right? You need to look at 2 other people's posts and write something that indicates you actually read what they wrote, right? So the other thing is you can't pick a disease someone has already picked. So some people have already picked their diseases. They may not have actually wrote anything yet. See, they just picked their disease. But remember, you can write it in and then you can edit it later, right? Just by clicking your edit button and edit your post. So if there's a particular disease that you want to do, you may want to jump on real quick now, next couple of days, right? And write which one you're going to do so someone else doesn't snag it. So before you write yours in, make sure you look at the list and make sure it hasn't already been picked, right? Because you can't do one someone else has already done. So that's the one important component about this discussion board. I haven't graded the other ones. I know I'm bad. I wish the computer would grade it for me. But basically, remember, if you follow the instructions, eventually you will get all your points when I enter them in, right? Just make sure that you do what you're supposed to do, and you shouldn't lose points. Okay. So that brings us to wound infections, which we started last time. And, okay, I was just looking. I think we ended on tetanus, right? So again, these are the objectives, right? Be able to name the causative agent of this disease. Anyone remember what it is? It's a Clostridium tetani, right? So there's a list that goes for each one of these, and you'll notice it's a pretty systematic list, right? We're always going to be talking about the causative agent, right? Especially with wounds, we're concerned with anaerobic environments, symptoms, where does it come from, how does it make us sick, how do we prevent, how do we treat, right? That same progression. So the first one that we're going to talk about is Clostridial Myonecrosis. So the name kind of gives you some clues in it, and its common name also will help you out sometimes. It's referred to as gas gangrene. So these have some aspects about the infection itself. This is another one where we have to worry about endospores, and endospores that are prevalent in the environment, right? Nearly all soil or dust, right, contains these endospores. Rarely does contamination of a wound actually cause this infection. This is usually seen in wartime when wounds went for long periods of time without being taken care of and they had a lot of debris in them, right, from the environment. But you could still see these types of infections nowadays, right, when wounds aren't properly cared for, right, it could progress to this level. So symptoms tend to be very abrupt. The rapidly increasing pain, of course, localized to the area of the wound. Swelling occurs, and this is where it gets its kind of common name of being gas gangrene, is that it will ferment under anaerobic conditions, and in fact it will only grow in dead tissue, right, under anaerobic conditions. Under those conditions, it produces gas, right? And so then the gas is seen as this frothily, bubbly liquid that leaks from the wound. And that's why it's frothy, the bubbles from the fermentation and the gas production. The skin will tend to even more, because of the gas being produced, it'll stretch out the skin You'll have molten black spots where you have dead tissue. The patient will be very alert, be very ill, but alert, right? But if it progresses, then they could go into a coma, right, and even die. There are several species of Clostridium, so that's why it's called Clostridial, right, Myonecrosis. The most common offender is perfringens, is the actual species name. They're encapsulated bacteria, which means they have a capsule, which that's bad news for our immune system, right, because it's hard for them to be detected. It is a gram-positive bacteria. Most of your spore formers are gram-positive, right? It's bacillus, so it's rod-shaped. And as I said, the real reason why you would have something is if you have dirt in the wound, right? So you've gotten soil into the wound, these spores may have been introduced, and if you have a lot of dead tissue. So we're talking about serious wounds, right? Where you have lots of dead tissue. And then, of course, a delay in medical treatment, time for that spore to germinate and start growing. When it does, as I said, lots of bacteria that are pathogenic are toxin producers, right? So this one produces alpha toxin. We've seen this before, right? It will destroy the cell membrane and kill the cells. And it'll also produce other enzymes that are going to break down the molecules of the cells, the macromolecules of the dead tissue that's already dead. So it grows in the dead tissue, but then it's going to create even more death, right? So it's going to spread. It is unable to grow in healthy tissue. It only can survive in dead or poor oxygenated, because again, it's an anaerobe. It grows anaerobically. And then once it's established in that dead tissue or that low oxygen damaged environment, it's going to produce toxins and cause even more tissue death. And then under these anaerobic conditions, it's fermenting, right? So it's producing the gas, and the gas, even the pressure of the gas, can help spread the organisms to other areas. So how does it move throughout the environment? It's actually found in our feces, this organism of humans and, of course, animals. It's also present in the vaginal tract from even healthy women, right? 1 to 9% of women could have this bacteria growing in their vagina. Usually only causes problems, right? Again, we have serious injury. So self-induced abortions can sometimes cause an infection of the uterus from the bacteria migrating from the vagina. Miscarriages and after childbirth, it's very rare, right? Because hopefully there isn't significant trauma or damage to the uterus. But if there is, there's a potential for that infection to form there. No vaccine, right? But again, this is a wound infection, right? You usually have to have a serious wound. You have to have death of the tissue. So prompt cleaning and removal of dead tissue, right? So that there's no place for it to grow. Depending on the amount of dead tissue, you may have to have amputation, okay? And that's because, again, dead tissue cannot be restored, right? And if it's too extensive of a damage, then it's more of a hindrance to the body than it's a help. Because of it being an anaerobe, oxygen under pressure conditions, under hyperbaric conditions, so hyperbaric oxygen is used as a treatment for a serious wound. And because of that influx of the oxygen, it's going to stop it from producing the toxins. Now, to kill the bacteria itself, right, penicillin is effective. It's a gram-positive bacteria, right? So penicillin is a very effective drug. No growth, no toxin production, right? We can get this infection under control. So notice again, 1 to 5 days. So what's the name of the causative agent? It's a Clostridium species, right? The most common offender is perfogens. Is it gram-positive or gram-negative? Gram-positive. Can it grow under anaerobic conditions? Yes, and in fact, that's when it's pathogenic, right? Because that's when it's going to produce its toxins. Name the types of wounds that would provide a favorable environment for growth of this bacteria. So we're looking at anaerobic type environment. So what type of wounds do we want to be particularly careful of? Incisions, lacerations, punctures, contusions, burns. What you think?
A lot of AMS dogs, you have like homeless people who wouldn't take their shoes off.
Mm-hmm.
You know, they have to take them off. And a lot of times you actually miss that.
Yeah.
Yeah.
Yes. Yeah. So you're saying about people not taking their shoes off and not realizing they have a wound, right? And then not taking care of it, where this could develop. So a puncture wound, remember, can generate an anaerobic environment. Any type of crushing, contusion where you have a lot of dead tissue, burns, where you would have that anaerobic environment, right? And again, those are pretty serious wounds usually, right? You're going to hopefully seek medical attention and get them cleaned out properly. What type of damage do the toxins cause? Type of damage. What do they do?
Sometimes if it's very infected, you have an invitation to say
Yeah, but what type of damage are the toxins doing?
it's killing the tissue.
It's killing the cells, right? So it actually causes cell death. Right? They're killing the cells, they're destroying the cell membrane. So what would be a really distinctive symptom of this infection that we mentioned? It would be kind of a dead giveaway that you got this gas gangrene or Clostridial Myonecrosis, referring to death of how the skin looks, right? Molted and that frothy, right? Excrement, that oozing. Yeah. The bubbly oozing, right? The scratched skin, the discolorization as well. So what's the significance of that gas word, right? In gas gangrene, it's because they're actually producing what? Gas, right? The bacteria are actually producing gas, and again, that's why you would have that frothy, bubbly oozingness from the wound. Where does this come from? What's the main reservoir?
The soil.
The soil. And how is it transmitted throughout the environment? Poo, right? Feces, right? Feces of animals and humans. So what do we need for the disease to develop? What's the first thing? We need dead tissue, right? We need an anaerobic environment or dead tissue in order for this to progress. And then once they're in that anaerobic environment with that dead tissue, what are they going to start doing? They're killing the tissues by what do they produce? A toxin, right? They produce the toxins under those conditions, right? And they're going to cause even more tissue death. How would we prevent this? What are some measures? Yeah, but before we even have the infection, that's treatment, right? Penicillin's treatment. What's prevention? Well, if you have a wound, right, you can't help it sometimes when you've had a wound, right? What are you going to do when you have a serious wound? Get proper medical attention, right? And they're going to clean it properly, make sure there's no dirt in the wound, make sure to remove any dead tissue, right? If it's a serious wound, because of that, amputation might be necessary, right? So how do we treat? Well, it's a bacteria, it's a gram-positive bacteria, so in this case we can treat with just good old penicillin, right? That's why during wartime, right, when we actually had penicillin available, it was such a wonderful thing, right, in helping with some of these infections. So the next one is cat scratch disease. This is an interesting one. So the symptoms will begin within a week of a scratch or a bite. And the important thing here is that's the most common thing, but we're still talking about a wound, right? And in this case, the wound usually is a scratch or a bite, of course, from a cat, right? But not always a cat. You'll have an infection at the site in the skin, almost like a pimple that will form, a pus-filled pimple. But then the bacteria, remember when we have infection, it'll travel through the lymphatic system and it'll hopefully get trapped in the lymph nodes. And typically that's what happens, but it takes a significant amount of time for the body to take care of it in the lymph nodes. So nearby to the wound, you'll usually have very enlarged, painful lymph nodes. May even become pus-filled, as the infection is even in the lymph node itself. Some patients may experience fever. The causative agent is Bacillus henselae. It is a gram-negative bacillus, so it's rod shape. It does have a slight curvature to it. And so you can see here on this individual, you can see the wound, right? The entry point for the bacteria. But notice here in the armpit region, that swollen section right there, that's some swollen lymph nodes in the axillary armpit region there, where it has traveled up the lymphatic system and infected that lymph node. The disease is typically self-limiting, which means it would pretty much take care of itself, right? But it's going to take a significant amount of time, 2 to 4 months. But you can have some complications that develop, so obviously if it's properly diagnosed, we'll try to treat. Some cases they'll have eye irritation involvement depending on what lymph nodes are involved. Again, that enlargement of the lymph node is a pretty dead giveaway that we got something going on. Encephalitis would be an infection of the brain, right, which could result in seizures and coma. Again, this is not very common, but it is a complication that can happen. And fever is definitely usually seen when it's entered into the bloodstream or affected heart valves. Virulence factors. What causes this infection, right? What causes this inflammation in our lymph nodes? Why can't we take care of it? We actually don't understand it very well at this point, right? There are some diseases, right, out there. We still don't know exactly why our immune system doesn't quickly attack and eliminate them, right? Why they're able to persist and cause illness. Some additional complications that can happen if it spreads system-wide is that you can have cysts that form in the liver. So this is pleosis hepatitis. And bacillary angiomyostis, oh, that was a tongue twister one, is where the bacteria will be growing in the skin and it'll cause formation of blood vessels in that area. Really weird complication that can happen. Mainly occurs in people under the age of 18. The reason being that it's a zoonotic disease, which means it's mainly a disease of animals, right? And only accidentally transmitted to humans. So how does it go from the cat to the cat? Fleas. And dogs can get this infection too, although it's mainly that we see it in cats, and it's most commonly transmitted from cats to humans. The reason being, if you've ever messed with a cat, right? They like to scratch and bite, especially when you're dealing with kittens, especially feral kittens, right? And what are the chances that it's going to have fleas and may have this infection? Pretty high if you're talking about not someone's pet, right? If you're talking about a feral cat in the environment. And most kids think, oh, cute kitty, right? And they go up and they try to play with it, and the cat bites and scratches them to get away. So most of us, right, when we've reached about the age of 18, we know to use caution when being around these types of animals, right? We know to avoid this. Person-to-person spread does not occur, right? This is not a contagious infection. Again, bites and scratches are the usual mode of transportation, but if you have a wound and you're messing with the cat, even the cat's saliva or the fleas themselves, the poop from the fleas is infectious. It could get into your wound, right? Asymptomatic, what does that mean? What does asymptomatic mean? No symptoms, right? No symptoms. So the cats, right, commonly have this infection and they don't even seem sick, right? And this is true for a lot of zoonotic diseases, right, where the animals don't seem like there's anything wrong with them, right? It's a common infection for them, but can cause serious problems for humans. So no proven preventive methods other than obviously, stay away from the causative agent, which cats are the main carriers of, right? Avoid handling stray cats. Promptly cleaning wounds. This is true for all wounds, right? And if we have any signs of infection, right, we're going to seek prompt medical attention. For this one, ampicillin, because it's a gram-negative bacteria, we can't give penicillin. But what ampicillin is a derivative of penicillin. So here's our plain old penicillin. And this modification right here is the only difference between penicillin and ampicillin. But that makes a huge difference. It makes this drug what we refer to as broad spectrum, right? Where penicillin you're going to give mostly just for gram-positive infections. Ampicillin works against gram-positive and gram-negative. Can actually get into the gram-negative bacteria. Unfortunately, though, and one of the reasons why I showed you guys the structure of this antibiotic is that it has this characteristic ring structure. It's referred to as a beta-lactam ring. And there are some bacteria out there that produce enzymes that break this ring structure. And so notice it's present in both ampicillin and penicillin. Penicillin, amoxicillin, these are all derivatives of penicillin. These are chemically modified penicillin, which is a naturally occurring antibiotic produced by the fungus Penicillium, right? And chemists have modified it, like adding this amine group, so that it actually will be effective against gram-negative bacteria as well, right? So remember, though, are your normal flora safe? No, right? Antibiotics will affect them as well. So what's the causative agent of this disease? Bordetella henselae, right? Is it gram-positive or gram-negative? Gram-negative. What's a zoonotic disease? It's mainly in animals, right? Accidentally, usually transmitted to humans. So why? Because it's mainly a disease of cats and dogs, right? And accidentally transmitted to humans. What's a distinctive symptom? What would really clue you in that someone might have this type of infection?
Swollen lymph nodes?
Yeah, swollen lymph nodes and near an area where there's a wound, right? That almost like a pustule, a pimple. So how is it transmitted to humans?
Bite or scratch.
Bite or a scratch, right? But most importantly, if you have a wound, right, it could be infected. How's it transmitted between the cats?
Fleas.
Fleas. That's how they get it. What should we avoid? What's one way we could maybe prevent? Stay away from stray cats, right? And cats that have fleas. Be very cautious. What we do for treatment? The antibiotics, right? So in this case, ampicillin is effective. So that's it for wounds. We'll start on skin.